Also, they lose the vertical dimension, horizontal dimension, and the centric relation. If you have teeth, when you bite, all your teeth, they bite in the same point. This point is the maximum intercuspation. The teeth they grow together. The teeth grow together like that. The bite will be in the maximum force. And this bite controlled by muscles and ligament. I'm not going to talk about the muscles movement, muscle mastication, and the ligament that control the mandible. All these will be gone when you lose the teeth, the whole teeth. They lose the centric relation, vertical relation, and the support to the lips, support to the cheek. Their face looks smaller, their chin will be near their nose, facial structures all will be, even the muscle, because they are weak, because they don't use them, and because if you see the dentures people, their gum become itchy, and they itchy their gum upper to lower, they itch their upper lower, so they have parafunctional. And this is because the joint it developed around the teeth. So this is parafunctional movement, so they may have another problem with their joint too. All that because they lost their teeth. So when you create the teeth, you not create just teeth. We restore the function, aesthetic, psychology, because they are in trauma, because they don't have teeth, they cannot work, they cannot smile. We have to create the vertical dimension, their face. When you lose the teeth, face looks smaller. When you put the teeth back, we create the vertical dimension, horizontal dimension, the centric relation between teeth and jaws and the joint. All these steps. So whenever they go to the dentist, the first step, they take history, take x-ray, see if there's root, and they check, they have to sign the insurance and everything. So they take primary impression. That's primary impression. They take primary impression. Usually primary impression done by alginate. Now they have good alginate. There's heavy body and light body. Heavy body will give you bulk. The light body will give you fine details. So they mix them together. So you can see the light body for fine details, and the heavy body will give you the bulk. That's primary impression. That's the first impression. Remember when we talked, there is when you extract the teeth, there is landmarks to guide you where you're going with the teeth. So these landmarks should be visible in the cause when you take. Like the labial frenum, the freni here, it's an extra soft tissue there. It might interfere with the setting of denture. Alveolar ridge, retromolar band, lingual freni, mylohyoid ridge. All these are extensions should be visible in your impression. In the upper we have incisive patulid, would be palatal root area, medial palatal arete. All these landmarks should be visible. This is the primary impression. Looks very good. This primary impression will be sent to the dental lab. The dental lab make them steady cast. Sometimes we can use the wax frame to make a boxing. You can box it. It would be easier for you to open it. And you put the box around it, and you mix the stone, and you create the cast. We call it steady cast, because this is the first one. You steady the case, the dentist steady case, and on that steady cast we create. This is the dimension of the. Remember this? We create custom tray. It has a handle. Sometimes some dentists ask for extra handle, extra pressure here, extra pressure point here on the premolar area. So it depends on the dentist how they do it. And then on the custom tray we take the final impression. Final impression here. You know what this line?
I remember what it's called.
It's a vibrating line. It's the line between movable and immovable part of the soft palate. This part, our denture extended here. That's it. Sometimes, how they find it, they look at the patient, tell the patient, say and when they say there's movable part, and they have a special pencil, will color it on the palate. So when you take impression, it show you the extension of your denture. Also, this area we can do a little bit of pressure here. We can post down area would help retention of upper denture. This is the final impression. On the final impression, what are we going to do? We're going to make the master cast. The master cast. On the master cast, we have to create these record bays of bite rims, wax rims. These are measuring devices. We measure the vertical dimension, horizontal dimension, the support, the lip support, the cheek support, made of wax. Usually, if you communicate with the dentist will give you numbers. If they didn't, in the books we have this generic numbers. And the upper is the 22 millimeter, the height, and the posterior, and the lower would be 15 to 18. The back would be 18, and the width of the wax rim anteriorly should be very thin and flare out. So if you go with these numbers, it's fine. But even if it's like 4 here or 7, 8, if it's uniform, looks good, it's fine. And in the lower, the height is 18 to 15, and the posteriorly in the back, it's a level 1/3 of the retromolar head. So these are generic. You make the wax, you add the wax, remove the wax until you make the record base. Go to the dentist. The dentist has to measure, have to find the occlusion line. You have to find the centric relation. They have to have vertical relation. All these done as in the clinic. This is the third clinical visit. The occlusion line should be parallel to the interpupillar line between the eyes. The occlusion line is where the teeth meet. Should parallel to the eyes anteriorly. Also should be that's occlusion plane. Should parallel to the eyes. Also should be parallel to another line in the book called fabricate line, but clinically we use allotragus line between the L of the nose and the tragus of the ear. That's allotragus line, the occlusal plane. So how they do that? Dentists, from the wax, they add wax, remove wax until they have the parallelism.
So where that device is equal to the occlusal plane?
Yeah, so this is the bite plane. So they remove wax, they add wax until they found this parallelism.
It's parallel.
Yeah. And also there's lines the dentist has to find. Midline. The midline when you set up teeth. The smiling line. When you smile, it should show 2/3 of central incisor. You've seen people when they smile, show the gum.
Mm-hmm.
We call it gummy smile, horse smile, some people they call it. But when we do denture, the smile line should be 2/3 of central incisor. Also the canine line. The canine will usually, the canine is in the level of the pupil of the eye.
Did not know that.
Yes, usually is the corner of the mouth. And the canine line is the transition between anterior to posterior teeth. So when you find the canine line, immediately you know the width of your teeth, because they're different in size. Some of them large, some small. Some patients are giant, some patients are small. And these lines should be found and sent to the dental lab. So the dental lab, when they set up the teeth, they have all these lines. And then they transfer it to the articulator, mounting the pickers. This is the vertical dimension. Vertical dimension, people when they lose their teeth, they lose the vertical dimension. How they can retain it? There's when you sit watching TV, you look and rest. Your teeth are not in contact. We call it vertical dimension of rest. And when you bite, your face gets smaller. We call it vertical dimension of occlusion. But the difference between vertical dimension of rest, vertical dimension of occlusion, about 2 to 4 millimeter. So if you find the rest, vertical dimension of rest, you can reduce it so we can find the vertical dimension of occlusion. That's vertical dimension of rest, 2 to 3 millimeter vertical dimension of occlusion.
That makes so much more sense.
Yes, but it will help if your patient has old cast, if they have old photos, because we can use the photos, we can measure. And if they have old prostheses, they have old dentures can help you, but they have cost. It's very good, helpful. So if you take impression for yourself and your family, just keep the cost. So facial appearance, because the dentist will add wax, remove wax, support it. They add the wax, but if you put too much wax, it will look ugly. If they don't add wax, the lips will go backwards. So the dentist will measure how much wax. They add wax, remove wax.
And it should be at a 90-degree from the nose?
Yep. Yeah, that's good. You're
Yep.
phonetics. Also, the thickness of wax. Some sounds are affected by, we call it lip tongue sound, affected by teeth, dental sound, like V, S. These affected by teeth. Some people, when they lose their teeth, their sound will be different. So the phonetics is also important. I have a big lecture about phonetics. I think we have to do it phonetics in a complete lecture. It's a big deal because people, when they lose their teeth and when you set up the teeth, will affect how they speak. Phonetics, centriculation. There's many ways to get centriculation. The centriculation is the maximum joint point, and also it's where all the movements start from the centriculation. When the patient moves forward, their chin forward, backward, left to right, eccentric, they start from the centriculation. So there's many ways the dentist will find the centriculation. Sometimes they put sticky wax, and they will find it, and they glue upper and lower together, and usually wax or special material, and they put it on the articulation. This is the centriculation they will find. This is how we gonna set up the teeth. They will send back this from the dental lab technician. The dental lab technician has to set up the teeth on this relation. This is the position, centriculation. Also, because I told you the canine to canine, we can measure the width of their teeth, their future teeth, color, size, shape, and selection.
But once they find the central relation, then they take and get it all smooth where it lines up.
They send it to the dental lab. When they found it, they put an articulator, they set up the articulator together. So when you set it on the articulator, you mount it on the articulator, it will never change now. And you measure this, and dental lab will set up teeth on the measurement that they give, the midline, the canine line, the smiling line. They set up teeth. Very good lecture about this, setting teeth. Now, these teeth are set up in wax. So this denture looks like a denture, but it's not real denture because it's wax. So we call it trial denture. They send the trial denture to the dentist try it in the patient. Check the smiling line, phonetics, vertical dilation, the stability, teeth position, overall position, the color of teeth. Some people, I have many patients, they want a gold tooth in the middle. Some people, they need diastema between teeth, gap between the front teeth. All these will be done, and they take a picture of it, and they make the patient sign on it, because this is the last step before when we do flasking and processing of the denture. If everything okay, patient like it, and the dentist like it, they send it back to the dental lab. The dental lab is a process we call flasking. We remove the wax, we pack the acrylic, and this is the process. This is the flask. They have injection now. This is different. Packing. This is the packing method, and there's injection method, and they finish it and polish it, and then if everything okay, they delivery on such. This delivery is the fifth clinical step. Adjustment if there's a high spot, and nowadays this is what I experienced. We do one molar. We don't do two molars. Because usually we never do wisdom teeth first. And because of the denture, especially lower, and the first molar, second molar will be on the slope of the retromolar band. so we reduce the stability of denture. And most of the chewing on edentulous or people on complete denture, they chew on the premolar area. They don't chew on the molar. And a human with natural teeth, they chew on the molars area. But
It would
if
cause
you,
tipping if you had that second one, right?
yes, and you polish it. Sometimes there's further left step, sometimes adjustment, relining, and repainting.